Lee, you had your own personal experience with some knee pain. Talk to us first how you attempted to classify yourself, and then what happened, and then what did you have to go to help resolve that issue?
Yeah, so I had a CrossFit box for many years, and I was at a CrossFit competition in 2014, and I was on a workout where you're doing a clean and jerk ladder, and I was already had done other workouts, so I was kind of tired. And as competition goes, I tried to do a little bit more than I knew I could, so I was trying to put a little bit more. It was going to be a PR if I had got a clean and jerk, and when I got the weight up, as soon as I got ready to dip and drive, my left knee buckled, and and I had to finish the competition, which is kind of interesting in itself. But I literally couldn't squat. I mean, air squat. I couldn't air squat for 6 to 9 months. It was so painful. And the interesting, I sent the MRI to a friend of mine in Oahu, an orthopedic surgeon, and he just thought by his assessment, he thought I'd ruptured my patella tendon, but I knew I hadn't because I could straighten my knee out. It just hurt like a mother. But I basically
wait, that's a basic test, right?
Yeah, so, exactly. And so, yeah, but I mean, it's just tremendously painful. So for 5 years, I did everything. I mean, I cleared the spine. I flexed like, my lumbar spine. I side glided. I gave it at least a couple of days of each one of them, no change. Made my way down the knee. I never had a motion loss. Never really swelled much. And I ended up having that MRI, like I said, because I was really scared I did something. And this is kind of a great point I always like to add, is my knee, my MRI, because I did both of them, literally had like 10 things, okay? And as we know about MRIs, what do we really care about them for the most part? And because I literally, and this was in 2014 in my 40s, so I literally had cartilage tears on both of my knees, medial and lateral. But guess what? I've never had any joint problems with my knees whatsoever. But what the MRI did say that I will say I know was pretty relevant. The underside of my kneecap, the cartilage was shredded, is what it said on both of them, but really bad on the left side. And I could literally just thump my kneecap. Like my kids one time just bumped into me and it put me on the ground because it's so tender. And even to this day, I can kind of just palpate kind of underneath that top surface of my kneecap, and it's painful. Well, fast forward, you and I, both of you guys can attest in our 3 Peru trips that I would cry like a little baby when we go hike. We'd always do our CrossFit workouts that I would just complain about my knee, and you guys would try to ask me all these questions, and I'd of course get frustrated. Well, I've done that, whatever. And then I just said, I'm going to roll up my sleeves. Jason, you and I met one conference, and we just would work out at the gym, at the hotel gym. And I just rolled up my sleeves. I'm going to remodel this thing. I just figured it's boning. I'm going to remodel it. And sure, I got much better. I got to where I could squat a lot better, but it still hurt. Pain during movement. And I remember I was talking to a clinician at one of our conferences. They mentioned, hey, try open chain knee extension with light load, a lot of reps. And they've had some results with that, but it only made it hurt worse. And so fast forward, I'm at a World of Hurt conference. Shout out to Annie and Melissa. And Lynn was there, and she said, hey, Lee, I got something for you. And she had just started her little journey. And sure enough, she started on one of our foundational movements, or rockers and air chairs. And I couldn't get in the rocker at all, not because of my knee, but because I had lost inversion of both of my ankles, which you don't ever miss unless you really check it. But it was so painful from just spraining ankles over the years that I couldn't do that.
And just to clarify, that rocker is a quadruped deep knee flexion. You're sitting back.
Think about just looking at a little kid and see how they sit. Exactly. And that's what we call it, a child rocker, getting back to how we were born, right? But the interesting sidebar there is I'm also one of those guys, you check my ligaments in my ankle, very loose. As a matter of fact, I can put them in position sometimes. I almost feel like they're going to sublux. And so I always sprain my ankles. I could turn, I could step off a sidewalk, I can hike and step on a root and turn my ankle. I don't sprain my ankle anymore. A, I got that mobility. B, as you heard where we agree with Tim Hewitt, keep your heel off the ground. Once your heel hits the ground, you are at risk for injury. And what is a sprained ankle? Your heel hits the ground, and there's a point of no return because you don't have any strength there. There's a point of no return that's going to go. And so now that's one of the most liberating things ever because I'm a big hiker and I don't have to worry about that anymore. But going back, so I don't sprain my ankles anymore. And but after about 3 months of doing this stuff, working with Lynn, and just going through. And this is before I even went through anything. I was just doing, and I started dabbling this with my patients, by the way, as well. But in 3 months, I was squatting normally. And granted, the squat that we use in GOATA is not your traditional squat, because everything is geared toward forward locomotion. And a traditional squat, which I taught everybody as a physical therapist and a CrossFit coach, toes slightly out, knees over toes. And oftentimes that's front chain dominant as well, behavior, the way we teach it. And so now I'm doing the squat the right way, and I don't have pain anymore. And if I squat the wrong way, I still have pain, because I still have that shredded kneecap cartilage, because, you can't undo, when you've destroyed your joints, you can't undo that, but you can sure get back in the mat and feel a lot better, which I do. So, and one other thing, talking about using my patients, I have this one orthopedic surgeon who sends me tons of spines, and I haven't convinced him to send me a lot of extremities yet, but he sends me all these older people. And everybody before GOATA, everybody, and they still do, but everybody in my clinic was going to squat, right? Because if you can't squat, you can't take care of your back the right way. Well, before going through the system and just what little I learned from Lynn, I started putting these older patients in the rocker position, because everybody inevitably that's older, when you start trying to get them to squat, well, I can't, I've got knee pain, I've got arthritis. And inevitably with this doctor, they've all started getting the shots in their knee already. Well, lo and behold, I start getting these older patients in the rocker after they look at me like I've got three heads. When you try to put a 60 or 70-year-old in a rocker position on their hands and knees with knee pain, they start getting better. The knees start feeling better. Now, granted, I'm not saying they're. What's that?
I take offense to that, Lee. Come on.
Well, think about it. We're not talking about, GOATA H like you got, Lynn. We're talking about people that in their mind, they're old. They've got these arthritic joints, and an arthritic joint that's stiff is going to be a lot more difficult to deal with than an arthritic joint that's as loose as you can get it. And that's just has been a pleasant side effect with my spine patients, that I start putting in the rocker just to start working on. When they started telling me their knees were bothering them, they'd come back and say, hey, my knees are getting better. Or B, we would notice from day 1 to maybe day 3 or 4, they're sitting way further back in those rockers, and they're kind of surprised about it. So it's applicable to everybody. It's the bottom line. Everybody's a GOATA athlete.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.